Hi, I'm Dr. Tamar Kessel, and today I will be speaking about lumbar spine ablation. So low back pain is a very big problem, with more than 80% of the global population experiencing low back pain at least once in their life. At any one time, it's prevalent in 4 to 33% of the population. Half of the adult population in the U.S. report having experienced low back pain within the previous year, and a quarter report experiencing low back pain in the previous 3 months. And this is associated with a very high cost, so an estimate of $100 billion per year in the U.S., and this is primarily due to lost productivity and wages. So where does low back pain originate from? So it can come from the lumbar facet joints, which we're going to focus on today. And these are the small joints on the side of the spine that give us mobility. They allow us to twist and turn. It can come from the sacroiliac joint, so that's the joint where the low back meets the hip. So if you look at the lumbar spine turns into the sacrum. Where the sacrum meets the hip, that's the sacroiliac joint, and we have one on each side. It can come from the intervertebral disc. So these are the structures here between the vertebral bones, and it can also come from the coccyx, or what people refer to as the tailbone, which is way down here at the bottom of the sacrum. And while there's no standardized definition, chronic low back pain is typically defined as pain in the lower back that persists for greater than or equal to 3 months, while acute low back pain typically is defined as pain that lasts less than 3 months. And of the people who experience acute low back pain, around 2 to 34% will eventually go on to experience chronic low back pain. So what are some of the treatment options? We always start with the most conservative treatment options, and that would include medication. So for low back pain, things like nonsteroidal anti-inflammatories, Tylenol. Sometimes we use medicines that treat nerve pain like gabapentin, Lyrica. We really try to avoid opioids. That wouldn't be first-line treatment, and we really try to avoid them given, obviously, the opioid epidemic. Physical therapy, so things like core strengthening, hip mobility. The stronger our core muscles are, less pressure through the spine. We want to keep the hips flexible, because if the hip is tight, our backs move more to compensate, as well as things like educational or psychological therapy. So things like cognitive behavioral therapy, support groups, and educational sessions. And when these conservative treatment options fail, we usually go on to more invasive treatment options, such as steroid injections, so things like trigger point injections, epidural injections, ablations, which we're going to focus on today, and surgery would really be last resort. So when all else fails, sometimes people do require spine surgery. So the facet joints, again, these are the small joints here on the side. They allow us to twist, they allow us to move, they give the spine mobility, and they can account for anywhere from 15 to 45% of low back pain. So pretty large cause of low back pain. And what are the symptoms? So facet joint pain can present as achy pain in the lower back. It could radiate to one or both of the buttocks. It can also go down the thighs or into the groin. Typically, the pain doesn't travel past the knee. So when you start to get pain towards the ankle or the foot, that really suggests nerve involvement, or what people refer to as sciatica. The pain can be chronic, or it can come and go. It's usually worse with spinal extension, so arching the back and twisting usually makes the pain worse. And it's also usually worse with prolonged inactivity or standing. So why did the joints become painful? So when the facet joints are injured, pain signals from the facet joint usually travel along sensory nerves. These small sensory nerves, they're called the medial branch nerves, and that goes to the spinal cord and to the brain, which tells us that we have pain. And the injury can involve the cartilage, the capsule, or the ligaments that surround the joint. And where we feel the pain really depends on which facet joints are involved. So some of the higher up facets, you might feel the pain just in the lower back. The lower facets, we could feel it in the buttocks or the thigh. It can even wrap around into the groin. So how do we diagnose facet joint pain? So as with anything, we always start with a good history. So a patient could come in complaining of achy back pain. It could refer to their buttocks or their thigh. Typically, it doesn't refer past the knee. Again, that would suggest sciatica or nerve involvement. We then move on to a physical exam. So oftentimes, we'll have the person extend. We'll try to load the facet joints and see if that reproduces their pain. And then imaging studies, of course, such as x-rays or MRI, which might demonstrate facet joint arthritis or inflammation. And before we do a radiofrequency ablation, we start with what's called a medial branch block. So again, the facet joints, they have these sensory nerves that go to them called the medial branch nerves. And before we do the ablation, we would numb the nerves to the joint. And if that provides good temporary relief, that would make somebody a good candidate for an ablation, where we actually heat up, or you could think of it as, killing the nerve to the joint. So the medial branch nerves, they not only innervate the facet joint, they also innervate a small muscle in the spine called the multifidi muscle. And this is very important when performing an ablation, which I'll show a little bit later on. And each facet joint is actually innervated by 2 medial branch nerves. So for instance, to block the L5-S1 facet joint, we would need to numb the L5 and the L4 nerve. To block the L4-L5, we would need to numb the L4 and the L3 nerve. And this is done under X-ray guidance, and the target for the medial branch block is where the transverse process meets the superior articulating process. So again, before the ablation, we do that medial branch block where we numb the nerves, and we're looking for at least 80% improvement in pain for the first 4 to 6 hours. So oftentimes we'll bring people in for that medial branch block, we'll numb the nerves. We send people home with a sheet of paper to keep track of their pain relief for 6 hours. And if they report at least an 80% improvement in their pain, that would then make them a very good candidate for the ablation. So the ablation was first used in 1975, so it's been around for quite some time. And here's a picture of an ablation machine. And you could see these are the needles along the sensory nerves. We then thread an electrode down the needle. The tip of that electrode heats up, so that's where you actually lesion that sensory nerve so that the signal cannot travel to the spinal cord or brain to tell us that we have pain there. And before we actually do the ablation, we first do a test. So the first is a sensory test. So we stimulate the nerve, we ask the patient what they feel, so we're looking for it to reproduce their low back pain. We're also checking to make sure that the pain does not travel past their knee or to the foot, which suggests that obviously we're in the wrong spot and we'd be on a motor nerve, which would not be good. We then do a motor test. So because the medial branch nerve not only innervates the facet joint, it also innervates that multifidi muscle. When we stimulate the nerve, we can actually see a twitch response in the needle. So when we see this response, we know that we're right over that medial branch nerve. And before we actually do the ablation, we provide a lot of numbing. So if anything, people feel pressure, they don't feel pain. And it's actually all done under local, so no anesthesia is necessary. The person walks into the room, they walk out of the room, they can even drive themselves home. And the ablation is carried out at 80 degrees Celsius for 90 seconds. So what are some of the risks? So common side effects include temporary bruising, pain, and swelling at the injection site. Patients sometimes experience an increase in pain, but usually this is very temporary and goes away within a week. And very rare risks would include infection, adjacent nerve damage, injury to blood vessels, and/or abnormal sensation in the skin over the treatment site. That would be very rare because it is done under X-ray guidance and it's all done sterilely. So how effective is ablation? So we have a lot of studies that show it's 70 to 80% effective, especially in those who had a successful nerve block. Pain relief can start as soon as 10 days after treatment, and it can last anywhere from 6 months to 2 years. So it's not permanent. The nerves do regenerate or grow back, but we're looking for at least 6 months of relief. And the good news is when patients do feel relief, oftentimes they don't need as much pain medicines. They're able to do more of the things they like to do, like tennis and golf. And even though the nerves grow back, you can repeat it every 6 months as needed. I mean, sometimes people come back 2 years later, which is great, but if they need it twice a year, insurance does allow it. So it is a very nice conservative treatment option for people who experience low back pain from facet joints. Thank you.